Glaucoma, if you look it up in a modern textbook, will say it's an optic neuropathy. So that is a degenerative condition of the optic nerve, which can lead to sight loss if left undetected and undertreated. We're focusing on the relatives of people with glaucoma because they are a great deal more risk of developing glaucoma in comparison to the general population. And the first-degree relatives of a known glaucoma patient, that's the brothers, sisters, parents and children, should all have regular eye tests at least every 2 years. And our research has shown that our members and the public do not know of the increased risk, which can be 4 times higher than those without a family history. It's really important because it's estimated that in the UK there are something like 600,000 people who are thought to have glaucoma, but only half are undiagnosed. And even amongst our members, around about a third didn't know of this increased risk. And when we look at the general public, something like half of the general public are unaware that a family history could mean that they have a greater risk of developing glaucoma. And it becomes more common the older we get, and it affects about 2% of the population over the age of 40, rising to about 8% when we reach the age of 80. In the early stages of glaucoma, there are no symptoms, and the only way to be detected is to actually visit the high street opticians and have a full eye health check. And the issue is, because there are no symptoms, the patient is not aware that they're starting to lose vision. And once that vision is lost, it cannot at this stage be recovered. But the tests the optician would carry out are very quick and they're painless. So they look at the optic nerve head in the eye using an ophthalmoscope, and they measure the pressure in the eye using a tonometry, which is the puff test, the air puff test. And they also check the field of vision, which is described as perimetry. It initially starts as developing sort of patchy vision, and it's usually the peripheral vision that is lost first. But if they're picked up early and treated, then they'll retain very good vision for the rest of their life. And that's normally achieved by treating the patient with eye drops, although some patients may need laser or surgery. But it's really about retaining good quality of life. We're aware, for example, of a concert pianist who may no longer be able to play, and an artist who can no longer paint. For many people, one of the most serious consequences as the disease progresses is that they are at risk of losing their driving license, which obviously has significant impact on their quality of life and their social life and independence. Every patient with bilateral glaucoma, that's glaucoma in both eyes, are legally required to inform the DVLA, and then the DVLA will decide whether that patient should have an additional eye test to retain their driving license. The earlier that the glaucoma is diagnosed, the better, because with modern treatment, many people will be able to retain good functional sight for the rest of their life, and the vast majority will be able to retain their driving license. At least we would recommend every 2 years, even if you have no symptoms and you don't think you need spectacles, particularly if you're a first-degree relative of a known glaucoma patient, you should have your eyes tested every 2 years. And if you do have a first-degree relative who's been diagnosed with glaucoma, that eye health check will be free. The research suggests that the reason people don't have their eyes checked is because they feel that the optician is going to sell them a pair of spectacles. And I think we have to move away from that, and it's a different attitude of mind, that this is a health check. And it's not only glaucoma that can be diagnosed in a health check, there are lots of other conditions that also can be diagnosed. And the optometrists, the opticians on the high street, are very highly trained to diagnose these various conditions. And it's really important in order of retaining your sight. It is a question of maintaining your quality of life. And for many people, that means retaining their employment, maintaining their independence, and their social life. If they want more information, we have a helpline at the International Glaucoma Association, and they can call our helpline. That's on 01233 648 178. I'll repeat that, 01233 648 178, and that's available 5 days a week, Monday to Friday. Or they can visit our website, www.glaucoma www.iga.org.uk.